Elliot, how much more dangerous is cervical fusion compared to PICL? 100 times as dangerous. Yeah, Elliot, here's the only way I can do that math, if you will. And this kind of math is never super easy to do when we're talking about relative risks of procedures. What I can say is this: if you look at an upper cervical fusion, and you look at the percentage of time someone gets something bad enough to wind up in an ICU, excuse me. Let's start over. So if you look at the number of times someone gets something bad enough with cervical fusion to wind up in an ICU, it's probably in maybe the 10% range for an upper cervical fusion. If you look at the percentage of times that someone gets something from the fusion that's bad enough to warrant additional surgery or substantial medical care in managing that thing or that complication, that's probably 20% of the time. So if we then compare that to PICL, we're at more than 2,000 procedures and no one's ended up in the ICU as a result of this procedure. We're at 2,000 procedures, and the number of patients that have gotten severe things that require substantial additional medical care that are clearly a result of the procedure, meaning there's a clear connection. The procedure happened, and then that thing happened, and then that resulted in substantial medical care, i.e. a surgery. It's, near as I can tell, zero or pretty close to zero. So, is that 100 times safer, 1,000 times safer? I don't know, but I can tell you it is dramatically safer than a cervical fusion if you just look at the published data on complications for cervical fusions in general and upper cervical fusions in particular, which are even higher risk. Lindsay, have you ever studied patients with EDS who have ligaments damaged from Cipro?